Welcome to Health Matters with your host, me, Dr. Lana Marconi. Tonight we are going to explore energy medicine and look at energetic disturbances and alignment. Please feel free to call us with any questions that you have for our panel. The phone number is 905-595-LIVE. My first two guests have doctorate diplomas in traditional Chinese medicine. Please help me to welcome Robert Youngs and Zoran Jelicic. Welcome, gentlemen.
Thank you, Dr. Lana. Thank you.
Well, tonight's show is about energy, so I want to feel your energy, and I want our viewers to feel your energy.
Thank you.
Okay, so TCM, traditional Chinese medicine, what is that an umbrella for?
Well, traditional Chinese medicine is energy-based medical system with 5 modalities in it. So we have acupuncture, we have Chinese herbal medicine, we have Chinese manual medicine, which is a massage and joint manipulation. We have Chinese medical nutrition, and of course Chinese medical Qigong, which is a central modality.
Yeah, so it's a huge umbrella,
It
Chinese
is.
medicine. Nice, nice. And Chinese medicine deals with the concept of qi, right?
Yes.
What is qi?
Well, the ancient Chinese viewed everything in the universe as having an underlying reality, and they called that reality qi. And that qi was in many different forms. So if we were to look at, say, water, right? Water, if you lower the vibrational frequency of water, it becomes a solid. If you begin to heat it up again, then you have a liquid form of energy, or a liquid form of substance. If you further heat it up, then it becomes like a vapor, right? So those three aspects of that energy actually relate to us in our in our particular human form. So the physical form would be like the ice, your qi or your energy like the water, which moves, and your spirit, right, or consciousness like the vapor, which is a little more non-material.
So there's different levels of qi, different dimensions of qi?
Yeah, it's qi will take on different forms, right, and if you like, manifest in different ways. So those three different ways are like solid, like a liquid energy or a moving energy, and then spirit, like a consciousness or awareness, if you like.
How vital is qi to our well-being? I mean, why should I even care about my qi?
Well, qi is the vital energy of the body, and without qi, our body is not going to function. So in order for us to function, we have to make sure we maintain a certain level of qi.
So wait, if there's no qi, we're you know.
Well, if it diminishes, then your functions are going to start to diminish, and that's going to affect us on all those three levels. So physically, it's going to affect us on a physical level. If you like, energetically, it affects us both emotionally and intellectually. And then it also affects us spiritually, our spiritual connection. So it's very important that we maintain this level of qi in order to function. If we were to take in, let's say, more qi than we're going to use in order for us to function, then we would kind of build up a reservoir, right, or a surplus. So in having that surplus then means that our body will last longer, so we'll have longevity. So of two aspects. One is to maintain our health, and the other is to increase our longevity.
Other important concepts in traditional Chinese medicine are meridians, points. So do you want to describe our energy system, what that is?
Sure. So meridians are these distinctive pathways that qi basically moves in through our body. And along meridians we have points. So it's akin to, let's say,
do I have points on my hand?
Of course, and they start from the top of your fingers, and then they move as we go by meridian, and then we have another meridian that usually follows from your body all the way to the end of extremities, and the points are following almost like a train stations alongside a railroad. So this qi itself has a polarity, and this polarity is expressed in yin-yang concept, which we later look in diagnostic way. So we find out that the 4 basic diagnostic concepts in Chinese medicine are excess yang, excess yin, deficient yang, and deficient yin.
So what does that look like? Because we're talking about energetic disturbances in a person. So if my yang is off or my yin is off or I'm excess or deficient, I mean, what am I going to experience?
Well, in excess yang, for example, on a physical level, you have elevated blood pressure, you have elevated temperature. Emotionally, you're more excited, at times maybe even angry. As opposed to that, deficient yin, we have quite opposite. So we have withdrawn emotional state, we have a lower temperature, decreased blood pressure, and so on.
How do we know meridians are real?
Well, it's a good question. Up to maybe 2005, we didn't have actually a proper scientific means to prove this. And
Okay.
in 2005, interesting research happened in Germany, led by Dr. Albert Fritz Popp, who's a leading world researcher in photobiology.
Okay, and we have an image of the, you're going to talk about this
Of course.
research? Okay, so we're going to post an image of meridians right now, and Zoran is going to speak to this research.
Of course. So what Dr. Popp did with his research assistants is they stimulated the body with the thermal agent that we call moxa, which is a rolled herb, and it's lighted and it's brought very close, couple inches away from the acupuncture meridians. And on the first picture, we have a stomach meridian, and this is taken by a thermal imaging camera that basically measured this operating at 2.4 to 5 nanometer frequency. And on the second picture, we see both stomach and spleen meridians. They're like highlighted. So this was the first research actually to prove beyond any scientific guessing that meridians are specific and real structures in the body where energy or chi moves through.
This is so fascinating because how did, I mean, Chinese medicine is at least 5,000 years old. So we have technology today that's showing that meridians are real. It's like, you know, when people had cataracts, we never had the science to measure cataracts. Now we do, so we can say that there are cataracts. You know, science always takes a while to catch up. But 5,000 years ago, I mean, how did people see meridians?
Well, the underlying theory and currently in traditional Chinese medicine circles is that people were less dense energetically, and they had something that we don't have today, which is infrasonic vision. So their eyes operated probably on a lower frequency, something like 18 megahertz and lower. So we almost appeared to them as a see-through structures.
It's very interesting. Robert, I know, you know, in TCM, emotions are a huge element in the relationship between emotions and organs and the flow of chi. Do you want to maybe speak to that? Because you know, some people with liver problems, I know that's associated with anger, or kidney issues. That's a lot of, oftentimes associated with fear and trust issues. So,
Well, whether you have externally induced or internally induced emotional disturbances, they begin to affect how how our body functions. And the basic emotions, right, are either positive or negative. So if we have a negative emotion, it causes the chi to constrict and not flowing and not functioning, whereas positive emotions cause the chi to expand. And so we look at what we call the negative emotions, which would be, you know, excess excitement, right, anger, fear and shock. Also,
what are the emotions that are related to each organ?
oh, okay. So,
Do you know the emotions?
Of
that
course.
yeah. So the heart usually should be either joy or excess anger. So that's like the positive and negative aspect. And in the liver, we either have as a negative emotion, you would consider anger, right?
Yes.
Resentment. In terms of
So that's how you know, like, someone has stagnated chi in their liver because they're angry, or in their
Yeah.
heart, for example.
overexcitement. So they're going to get
Overexcitement.
excitement, and you know, their blood pressure rises. Like so you see that in their aggressive, more
Right.
aggressive
Is
behavior.
laughter an issue there too?
Well, laughter is more of an expression of joy, so that's more like a positive expression, right? In which we simulate with that particular emotion, and it doesn't cause us any particular
What about the lungs?
compression. The lungs store the grief and sadness if they're depressed, right? And if they're not depressed, then it allows for a true feeling of wellness, really.
And the courage as well.
Encourage him.
And the spleen and the stomach. I mean, you can go on
Spleen
and
and
on
stomach,
with each organ.
yeah, worry and concerns bother the spleen, and positive emotions are more like you know, acceptance, right?
So if someone comes to you and they have, let's say, a deficiency in their kidney chi, or their yin or yang, and they have a closed heart, how does that work? I mean, what do you do to balance that?
Well, to balance it, there are several ways in which I work with as Qigong therapy and balancing the energy. One is to teach them basic Qigong exercises. And these Qigong exercises would focus on...
This is medical Qigong?
I'm talking about medical Qigong to address a specific condition. So in addressing the condition, we're going to use things like visualization, imagination, and prayer.
Okay, so give me an example, like a case.
Okay, so somebody has...
Yeah. Or just give me an example of somebody with a problem and how you would help them.
How I would help them was, first of all, to take them through maybe what I call 5 steps of healing.
Okay.
So those 5 steps of healing would teach them what I call deep breathing exercise. Because if you like, the deep breathing exercise is bringing the qi back into the body. And the qi acts as a mediator. Therefore, it's bringing, if you like, our mind or spirit, our consciousness, which contains our emotions, back into the body. So deep breathing exercises would be used to create more body awareness.
Can you give me an example? Like, how would you breathe?
Yeah, so if you imagine taking a breath in through your nose, right? And instead of filling, say, your lungs, imagine you take this breath in, you imagine your abdomen, lower abdomen filling first, right? Deeper breath in, then it reaches your diaphragm, eventually your lungs, and then you exhale in the reverse direction, so from the lower abdomen through the diaphragm, out through the nose. And what this does, it has a calming effect upon the emotions, because it brings, if you like, our mind or spirit back into our body.
And that's the first stage of the healing
That's
process?
the first stage. After that, using Qigong exercises would be to use visualization, imagination, what's called dynamic movement, so body movement exercise. And as that qi is led by the mind and the movement of our limbs, it creates a cellular activity, which begins to stimulate qi, if you like, to all the organ systems throughout our body and different meridian systems.
Do you practice this as well?
Of course. I study and we work together in a hospital for many years as traditional Chinese medicine practitioners. And we use this on a number of our trauma patients in the hospital, St. John's Rehab Hospital in North York. So it's a very effective method, because not only oxygenation of the tissue calms the parasympathetic mind, but visualization also.
Soren, I'm going to put you on hold for just un momento. Please, we need to take a break. We'll be right back on Health Matters and more with Zoran and Robert, and we're going to learn more about energy medicine and TCM. We'll be right back. Welcome back to Health Matters, and we're talking with Zoran and Robert, practitioners of TCM, and learning about energy, really. Robert, you were talking about stages of healing,
Yes.
So let's explore that a bit further and look at, perhaps go through some of the organs and maybe the sound vibrations that you would use.
Yeah,
Take me through a healing process.
Yeah, so if we have, let's say, what we were talking about before, a negative emotion, its effect is to compress the qi, right? Cause qi and
So if I'm
stagnation.
angry, my chi is just like
yeah,
this.
so everybody feels this, they're all constricted, they're in there, right? And then they explode with the excess energy.
Sure.
So we use some methods are used, what's called the 6 healing sounds,
Okay.
which means that for each particular organ, there's a particular sound which has a vibration that will stimulate that organ, move qi through that system. And so that's one way to release the stagnant qi. So a specific sound which has a vibration that's tuned, if you like, to that particular organ.
Okay.
And
are you going to demonstrate a sound?
yeah, we can do some sounds.
Okay.
So if we started, let's say, with the liver, because liver is like the first organ to get emotionally involved with, because it's our trigger for our anger. So what we would do is we'd have the person first to start with the deep breathing exercise, and then to focus actually on the anatomical location of their liver. And then they're going to inhale, taking this breath, and then when they release the breath, I'm going to ask them to focus on a particular sound. So if I was doing the liver, we could hold this, sorry. You put your hands on your liver, you make a deep breath, right? Breathing in until you feel the actual organ itself or its location. And when you make the sound would be shoo.
So as Robert makes the sound, we visualize on the liver as an organ. we visualize the green healing color of the liver. And as the robot makes the sound, the vibratory vibrations from the voice box move through the specific frequency, and by Chinese traditional medical theory, they relax the liver tissue and they release excess energy in it.
So you're using sound vibration to
Sound
heal.
vibration, and there would also be a little more dynamics to the exercise, because there's the internal relationship between the organ and its meridian and its opening. So the liver actually opens to the eyes. So when the patient would start by making this
So someone with
sound,
eye problems, is it
well,
because
it
of
would
the,
help,
is it because of the
yeah.
liver?
So
It
this
would
is some
help.
stagnation within the liver.
Yeah, because
So-
of the anger.
Yeah, so if they're
Yeah.
making this particular sound, as they inhale, right, their eyes would be closed. As they exhale, they would open their eyes, open their mouth to allow the sound to come out, and feel the vibration in the organ, traveling up, if you like, to the eyes, and then coming out through the mouth to disperse
And
this.
that's to clear the anger. You know what, this is really interesting, because what this brings up for me is the work by Greg Braden. I don't know if you know him.
Yes,
He's
I
a
do.
huge author, scientist, and he published a book called The Divine Matrix. And he did a talk in Italy, and he shows part of this clip about a medicineless hospital in Beijing. And there was this woman who had bladder cancer, and she was from the West here, and nobody could help her, so she went to Beijing to this medicineless clinic, and there's 3 practitioners. She had a tumor, it was like 3 inches in diameter, and 3 practitioners used chanting, focused their intent and their emotion, and through the sonogram, or you could see the tumor shrinking in 3 minutes.
I'm familiar with it.
Pretty much what you're talking about.
Well, that's it. Babe. That's using actually some external qi projection from the Qigong masters that we're working on, and then the patient themselves using their own visualization, right, and their intention to disperse the energy. So the mind, really, right? The mind is the director of qi. So the mind directs the qi.
Yeah.
So we have qi in our body, we have the organs to hold it, but without the mind and its intent, right? It would be chaotic.
What's the sound for kidney? Because I know kidneys are, like the battery pack in Chinese medicine, so
Yeah.
to speak. That's where what your prenatal
Yeah,
jing is stored, and if we use that up, then
Well, yeah, the kidneys are like the source energy for the body. And not only that, they're inherited energy. So really we think the inherited energy of the kidneys, you can think of it as all your ancestral energies are
are
there to
stored in your,
support you.
yeah.
Yeah, so
If you
form of
maintain
DNA
it. If
energy
you
that we
don't-
carry with us.
If you don't, like, let's say, you're bombarded with a lot of negative emotions, you start to internalize, right, and act in that way.
Yeah.
So that's how our mind, if you like, right, affects our emotion, and then internally that compresses or suppresses our qi.
So what would be the sound for the kidney?
So the sound for the kidneys would be like this. Again, you'd focus on the kidney. Same preparation. The patient would imagine breathing deeply, right, into their lower dantian, having their hands over their kidneys, and beginning to focus on the kidney organs themselves. And as they begin to release the sound, same thing, the eyes open to release the energy, and the sound is like this. It's Shri.
And while the robot is doing this, the patient is also visualizing the color of the kidney, because
What's the color of the kidney?
it's usually indigo blue or black, and that basically purges the sort of negative emotion the kidneys emit, which is fear in this case, and it strengthens the positive emotion, which is willpower in the
Willpower.
kidneys. Yes.
So in Chinese medicine, is it that emotions come before the disease?
No, so we have to look at kind of 3 aspects of ourselves, what we call Jing, Qi, and Shen, right? So the Jing is the essence, or that which makes up physical form, right? So that's going to be our function, how our organs function. And the second is Qi, or the energy within the body, right? So not enough Qi, right? Too much Qi, excess, right?
So hold on, I'm
Causes
just going to cut you off for one second. If someone is, if their qi is balanced, what does that look like?
Well, if they're balanced, then they should be in a more harmonious state. That's what the whole aspect of being in balance is that your organs function properly, you feel invigorated, you have enough energy, right? And your emotions, right, are balanced, as well as also your intellect, so clear thinking. And then we would say we would have the zest for life. Whereas if there's a negative effect, it starts to work on all of these 3 levels. So the level of spirit, right, would have to do with this emotions, mental clarity, and our spiritual nature, our zest for life, if you like. Any one of these three, right, which are affected. So if we're suppressed by negative emotion, we're oppressed, if you like, on a Shen disturbance. If we don't take the proper nutrients, we don't get enough qi, so we're suppressed on the qi level, right? If we overabuse our bodies, right, to excess, physical activities, too much childbearing, then we're going to affect the physical level. So whichever level is affected, the other two in turn are affected.
Okay. You know the movie What the Bleep Do We Know? They
Yes.
talk about emotions a lot,
Right.
and how most people are stuck in stimulus response, and because they are, they're just experiencing that same emotion, even though it's through maybe through different people or different events. They're kind of like in an emotional plateau, so they're not really experiencing, the levels of joy or happiness that really is their birthright. They're really stuck. So are the emotions, if someone's angry, is that a clue for them that, oh, there's something wrong with or there's going to be something wrong with my liver, or if I'm in fear mode, is my kidney going to be acting up?
Well, generally, it's seen as a qi stagnation level, where we cycle through one and same emotion, and if that persists for a longer period of time, weeks and months, then we see a deeper level pathology in energetic pathology, which is a blood stagnation, and that starts affecting organs more. So we see interplay between physical, mental, and spiritual. So if, for example, we see kidneys as an example, so if we have continuously cycling through a fear as emotion, we start physically experiencing lower back pain, knee pain. We withdraw from enjoying the life. Yeah. Psychologically, we don't have will to do things. We socially alienate ourselves from the society at large. So this is a progression if nothing is done.
Wow.
Yeah.
I like your sounds. Give me a sound for the lung.
Oh, the lung is probably the most difficult sound to make, right? So this is
Of course, that's why I picked it.
Well, the lung sound, right? The lung sound is, it goes through the same routine, right? Focusing, where the breath is to be released from in terms of that organ, and then the tongue will go against the back of the tooth, and it sounds like this. It's kind of like shooing a baby, right? Mm-hmm. But it's a shh.
And what's the emotion related to the lung?
So this is usually grief and despair.
Grief and despair.
Yeah. And if you can think, it's like a wind sound, right? So the lungs are the closest to the outside. You can think, right? So we bring in all the energy or the qi into the lungs. We absorb that negative energy. It's like a wind that enters into the lungs. So this sound is like vibrating the organ and allowing that wind to escape.
Right. It's, as opposed to keeping our emotions stuck in our organs.
Yeah,
right?
Of course.
And then that stagnates the blood.
That stagnates the blood, and we would also visualize the white color or sometimes metallic color, and that's the color of the lung. So we release, so you have a combination of the breathing, visualization, and of course later on they progress to physical movements, so everything is combined.
Is there another stage to your healing process?
Well, in the last stage, then you should have a balancing, once you kind of like move the energy, clear the energy, right? And then at the end stage is to balance things. So balance is usually done with visualization exercises, which involve breathing, say in circular patterns. So the most common thing is something called microcosmic orbit, which is to balance the yin and yang energy of the body. So putting the two energies back in place. And one way to visualize that is to imagine inhaling, let's say, from the base of your spine, up the back to the top of your head, to the upper palate, and as you exhale, back down the front of the body, back down to the base of the spine. This creates a circuit of breath, right?
Sure.
And that circuit, it means that the breathing up the back is the governing vessel, which is all the yang energy in the body. Breathing down the front stimulates or relates to the conception vessel, which is all the yin in the body. So circulating these two is like blending the two together. It's kind of like you mix them two until they both blend together in harmony.
What are some, we're coming close to the end of the second segment here, just quickly, what are some of the factors that attack our qi that we should know of? Or what tips do you have for people to keep their qi in harmony?
Well, a lifestyle choices are very important. So people
dealing with your stuff?
Dealing with your stuff. You have to get enough sleep. You have to eat proper at proper times. you have to keep emotions at even keels. That means if you have lots of anger, you have to find a way to release this. And people shouldn't be afraid of so-called negative emotions. We cycle through them. It's quite okay to feel a bit anger, envy, or anything.
To allow yourself to feel that, so then you can purge it.
Absolutely, as much as joy and love and everything else. We as human beings, we regularly cycle through all of the emotions.
Gentlemen, you know, it's been a pleasure. Thank you so much.
Thank you for having us.
For your time, for your knowledge, for your energy. Is there a particular message you want to get across quickly about TCM?
Well, I mean, TCM is holistic medical system, and it deals with the whole person. So that deals with physicality, emotions, and spiritual integration. And if people really want to look into dealing with their health issues holistically, it's a wonderful medical system to approach and
wonderful.
use it.
Thank you so much,
Thank you, Dr.
gentlemen.
Lana.
We'll be back with two ladies who practice energy medicine. Stay tuned. Thank you.